Good morning. Good morning, everybody. Welcome to the public session of today's Oversight and Engagement Board for the 19th of November at 10:14. Apologies for the late start, but we had some very good discussions in the private meeting, which ran over slightly. So I apologise to anyone that's watching. Although we're not going out live, we're actually recording this and it will be uploaded as soon as the meeting is finished and available for anyone to see. So I'll come straight on to the minutes from the previous meeting for the 12th of November and assume that everyone is happy with those minutes unless they put their hand up and tell me that they're incorrect. Excellent, thank you very much. We'll assume that they're okay and sign them off. I'm going to come to Lucy for the summary of the local surveillance data, but she's also going to give us an update on lateral flow testing as well as part of that, I think. So thank you, Lucy, over to you.
Thank you, Councillor. So the week up to the 8th of November was quite a challenging week for Northamptonshire. People will have seen, I'm sure, the surveillance report on the Northamptonshire County Council website and will have seen that there were 1,623 cases in the 7 weeks up to the 8th of November, which is a 54.3% increase on the previous week. So, you know, a really concerning and significant jump from the previous 7 days. In part, we know that that is due to people trying to make the most of the few days that we had between the announcement of the lockdown and the lockdown being enforced. But I think it just does go to demonstrate that just because you can do things doesn't mean that you should. And this is the clear and very stark impact of people's decisions and their actions in that period. If we go down to the third page, it gives a summary of the current position, and you can see obviously that very stark and significant jump in the week up to the 8th of November as mentioned. So there's obviously a continued overall increasing trend in the last 2 months, with cases rising significantly since the end of September. And the average daily case rate figures are similar to the weekly totals that we saw in September, and in fact now are even far exceeding that. Apologies, our slides seem to be slightly slower. It should be the next slide. So as I said, people can see that stark increase. If we go on to the next slide, the breakdown between the two genders and the age groups, again, we've still got a very heavy female bias in our testing and our results. Again, that is in part due to females tend to seek support for health conditions earlier than men. So again, just a reminder and encouragement for gentlemen in Northamptonshire, should they have any concerns, should they develop any symptoms, they must go and get tested. Obviously, by only finding out where the virus is, can we isolate and break that chain of onward infection. And I'm sure people will remember this has been quite a changing picture over the last few weeks, where we initially had that significant number of cases in the 10 to 19 and then 20 to 29-year-olds. And although we seem to have a stubbornly, persistently high rate in the 20 to 29-year-olds, people will see that that now has started to filter through the rest of the age groups across the county and into our over 60-year-olds as well, which is of increased concern because they are much more vulnerable and much more likely to suffer significant disease and significant symptoms of the virus should they actually be infected. So the next slide shows us again a summary of the picture across the county with the crude number of cases in that week, obviously showing Northampton as the borough most affected, but then followed by East Northamptonshire and South Northamptonshire. So again, following the trend in the last few weeks where our more rural areas have been affected, whereas they previously obviously had been slightly more immune. If we go down to the next slide, we can see the rates, which makes our areas more comparable. So Northampton still does have the highest rate in the county at 239 cases per 100,000 population, and that is now significantly higher than the county average and similar to the England average. So that's a big change. We have in most areas been statistically significantly lower than the England average, and Northampton as a borough has now caught up, and I can tell you that a number of the other boroughs and districts are not very far behind. So our rate of increase has been much, much higher in Northamptonshire boroughs and districts than it has in other areas of the country, and therefore we've caught up with the country average. Again, you can see we've got a sort of similar rate in East Northamptonshire, and as I said, a number of other areas that we're likely to see go into that space in this week's report. That's very visible in the next slide, which obviously shows the case rates graphically. You can see the blue line for Northampton starting to touch the England average rate, which is the grey dotted line. I just wait for the slides to get up there. We are. And again, East Northants very close behind, along with South Northants. But that grey dashed line, so the line that is the Northampton County average, people can see obviously that that has started to close the gap between the England average and our local county average. Again, a really concerning sign that obviously our rate of increase continues to be higher than that of the country nationally. The next slide just shows our position in relation to our schools and universities and colleges. I'm pleased to say that there are still a relatively low number of outbreaks, but each outbreak does affect quite a number of staff and pupils. And again, the University of Northampton case rate remains low, and they're working really hard with their student body and their staff body to maintain that position, and are obviously preparing, as we know, to start testing students in preparation for their return to home before Christmas. We've got 100% of schools open at this point in time, so the data went up to the 3rd of November, and we had a slightly lower than previous year's attendance at 91% compared to just over 94%. But you know, we know that schools are working very hard, both with the Department for Education, Public Health England, and our local teams in the school cell and in the public health team, to maintain this position and you know, obviously try and make sure that onward transmission remains as low as possible in those settings. People can have a look at the wards most affected, as we always provide that information on the following few slides. But if we go down to slide 13, the picture on the 9th of November, this was, from a point of view of outbreaks, had improved slightly, and we were dealing at that point with 65 live outbreaks, the lion's share of which were still in education settings and workplaces. But we have seen a significant increase in the number of outbreaks in our hospital settings, again through proactive swabbing of both staff and high-risk patients. So something that the internal infection prevention and control teams obviously are acutely aware of and managing very well locally. That position has unfortunately deteriorated in the last few days. We have had a significant number of outbreaks, which will be reported obviously in tomorrow's surveillance report. But needless to say, they keep both our environmental health officers, Public Health England officers, and my team extremely busy trying to support each of those individual settings with risk assessments, advice and guidance. If we go down to the last slide that I'll talk to this morning, it just gives a bit of an update on our current flu position. Again, we've got positive news in as much as we've got reasonably good uptake for this point in time in winter across all of our eligible groups. We're still waiting for the data on the sort of extended eligible groups. So these are the core groups that are eligible each year that we've got the routine data on. But people will obviously see that we've got at the bottom the change between last year and this year's is positive in most areas. Again, still more work to do with pregnant women, but thankfully we've caught up at least with last year's uptake rate. But we do obviously want to make sure that women and their newborn children, of course, because that immunity carries through and helps protect newborn babies who have no or very little immunity themselves, making sure that those pregnant women are vaccinated to give them that best opportunity to remain well over winter. So if I stop there and Councillor Morris, take any questions with regards to the data just before I move on to the lateral flow testing.
Thank you very much, Lucy. A very good summary as always. I'm looking around the room. There don't appear to be any questions, which is good. It obviously means you presented it very well, as always. I'm going to, you're going to come on to the lateral flow testing next, if that's okay. Thank you, Lucy.
Of course, Councillor Morris. So I'm sure people will have read about this in the news, and indeed media colleagues have asked us questions about this. So lateral flow testing is a new type of test that's available to identify whether people are COVID positive or not. And it's what's called a near patient test. So, you know, these things are undertaken and the result comes through within 20 to 30 minutes. So it's a much more rapid test. It is still a throat and nose swab, but it is then put into a test solution and treated, and then obviously timed from a point of view of getting a test result by a trained member of staff. And as I said, that can be turned around usually in 20 to 30 minutes. It's very similar. It gives a reading in a similar way to a pregnancy test. You get a line to confirm that the test is actually valid, and then you get a second line if you're positive. You don't get a second line if you're negative. It's still being piloted in some areas, and obviously the university are using it for one of the tests to be able to enable students to return home, and people will be aware that it's been rolled out at scale in Liverpool with military support. What we're pleased to say is our expression of interest to be an area using lateral flow device testing has been supported, and we're currently pulling together a plan to utilise that in different settings in the first instance, so that we can obviously make sure that we're comfortable with the processes, and it will help us facilitate things like potentially care home visiting. It will help us manage things like acute outbreak situations. And there are lots of uses that will be able to help facilitate services reopening safely and reduce the risk of onward transmission. It will take a little bit longer to plan a mass testing approach, but that obviously will be our ambition in the long term if it's ever required. But I'm sure people can appreciate the logistics around that, along with mass vaccination, which we're also working on as a system, are quite challenging. So we will, be working on that in the background, but we hope to facilitate some local, very focused testing in particular settings in the next month. So we're hoping to be able to do that before Christmas. The national government website's been updated to now include Northamptonshire as one of the areas that will be receiving lateral flow devices, and I'm quite happy to keep colleagues updated on progress for those plans over the next couple of weeks. But I do want to stress that the logistics of this should not be underestimated. The only things that we get supplied with nationally are the tests themselves, the personal protective equipment, and some devices to record the actual test results on. All of the staffing, the liability, the logistics, the storage, the training, everything else is the local system's responsibility. So as I said, on top of all of our BAU, managing the pandemic itself, managing vaccination planning, the lateral flow testing, wonderful opportunity as it is, again, is quite a significant draw on resources. So bear with us while we pull that plan together, but we recognise the value it can add, and we'll be trying to make sure that we focus and prioritise those settings that either have an immediate outbreak, as I said, or whether it might facilitate access to services that perhaps have been restricted for risk reasons up until now. So exciting prospect, but quite demanding on the local system. So bear with us while we pull that plan together.
Thank you very much, Lucy. And I think of particular interest is the rapid testing or the lateral flow testing. And we look forward to having more detail on that, because, and it was very interesting what you said about what is provided and what isn't provided. We look forward to hearing how we would propose to deal with that as and when it comes forward, because we're already very stretched, I would imagine, in pretty much every department. So we look forward to hearing from you on that. Thank you very much. I'm going to come now back to you, I think, again. Is Sharon's not on the call, I don't think. So we're going to have a testing update from Lucy as well. Thank you, Lucy.
Thank you, Councillor Morris. This is always a cardinal sin, isn't it, not to unmute yourself. So testing is going well. I'm pleased to say that all of our test sites, our local test centres, remain open. Northampton's has obviously transitioned over to university, thankfully issue-free, and we obviously have good capacity and good flow. Our test rates locally are good. They're all above 300 tests per 100,000 population. In fact, some significantly above and into 400 tests per 100,000 population as a 7-day average, and that's absolutely where we want them to be. The more tests we do, as we know from outbreak situations previously, the more we are able to identify where COVID is hiding and to get those people isolated to stop onward transmission. We also thankfully still do have 2 mobile testing units, and they are at Pemberton Leisure Centre at the moment and Brackley Leisure Centre, so covering some of the areas that the local testing centres, the static testing centres aren't. So hoping that people have got good access, obviously reminding people as well that they can access home testing kits, and as I said, as and when we can update them with a whole new range of testing options. With regards to lateral flow, we will of course keep yourselves and the public notified as well.
Thank you very much, Lucy. Very interesting, and as I've always said, it's one of the weapons in our arsenal against COVID is the testing capabilities, which are proving pretty resilient in the county. But we just need, as you say, everyone to keep getting tested as and when. And obviously, if we get mass testing, that's a different issue, because that's when you want everyone to go rather than just people with symptoms. But we'll hear more about that as and when it comes along, I'm sure. I'm going to come now to contract tracing, which is again Lucy again. Hello, Lucy again.
We need to make this up a bit, don't we? I do apologise. But really good news in relation to contact tracing. Obviously, people will remember we took it on in August. We have a large staff body who are coping with obviously increasing numbers of cases to contact trace because our case rate has increased so exponentially. The national team were following up around 69% of cases when we took on the additional responsibility. So this is a sort of a joint approach now, and we take on all of the contacts that they haven't been able to reach after 24 hours. And the last few weeks, we've been maintaining a rate between the 2 services of 83% of contacts being contact traced. And in the last week, up to the 17th of November, so very recent data, we're now following up 86% of our contacts. So really, really good news, and just brilliant news that the people in Northamptonshire are engaging with us on this, because it's so important to obviously share the information about who may have been exposed to COVID. You don't want to be putting people at risk and for them not to know, both from a point of view they could become very unwell themselves unknowingly, but also they could unknowingly go on and infect other people. So it's really important that people provide that information. This is all we use it for. We don't want to know anything else about you. We just want to know who is at risk and to help them isolate. Obviously, once they are identified as a contact, we're able to put them into contact with services should they need any food supplies, medication supplies or support. And we're starting to develop a programme whereby we'll be sending out texts on a more regular basis while people are self-isolating, to give them tips and hints and to keep them motivated to be doing the right thing, staying in and protecting other people and potentially saving lives. So again, it's a service that we continue to refine and develop. So I'm hoping people will share the good news with you.
Thank you. That is really good news, and it just shows how a local control of that test and trace, or track and trace, is very, very efficient. Obviously, we can always hope to do better, but still very, very good compared to the national average across the piece. So thank you for that, Lucy. Really encouraging. And again, I mean, if Boris Johnson and Dido Harding have been traced and told to isolate, then I think it shows that generally the system is working very well across the country. But it's very encouraging to hear the high percentage of our own ability in the county. So thank you, Lucy. Were there any questions? I'm just looking around the room. No. I'm going to come to Claire Hughes for a comms update with particular reference to the over 60s. Hi, Claire.
Good morning. Yes, to give you a quick update. We're obviously continuing to focus our efforts on reinforcing all COVID safe behaviour messaging, particularly where transmission rates are at risk of being high. Those are areas such as public transport, on buses, bus stops, where people are car sharing, and people are travelling to and from work because they have to get to work, so business and industrial parks. So we're using on-site and in-situ messaging in those situations. We've developed some bus back posters, so people travelling in cars behind who are possibly car sharing, just reminding them to wear their face masks and practice sort of safe behaviour. And things like we've got window stickers going in bus windows to sort of remind people that windows are open for ventilation, even on sort of chilly days. But obviously, I'm just trying to encourage people to wear their scarves and wrap up, but keep the ventilation going. We're obviously using all of our channels, social media, website, our COVID pages are constantly being updated with any FAQs that we get. And we have launched and continue to use sort of local radio campaigns, and Lucy is doing her bit with her twice a week radio interviews to try and get some of those messages across to a breadth of audiences. And of course, we continue to do our weekly Friday press conference. So if you're wanting to know what the latest sort of update on what the key messages are, then dial into that press conference on YouTube. And all of this is hand in hand with our colleagues and partners in other agencies. A lot of work is going on at district and borough level to try and get out into local communities, and we're trying to support each other with our messaging and activities and sharing that space. We'll also be uploading shortly our Ask Lucy video responses to the questions that were raised. We've got some interesting questions in there, so you might be interested to have a look at that at some point. We'll probably talk about that or mention that when we've definitely updated it at our press conference tomorrow, but the plan is to get that up as soon as possible. And particularly if you're a dog owner, you might want to to watch that, because it's got an interesting question there. I think the main thing is we're trying to get a bit smarter and we do know that there's message fatigue out there. Again, I've mentioned this before. So we've been doing some brainstorming. We're trying to look at some different ways to cut through and to reach particular audiences that resonate. We've got a focus group today where predominantly that's older people. And of course, we do know that there's been a rise in the 60+ age of cases. It's really critical that we not only get the messages across to those people in the right way, but also to the people that are engaging with those, the family members, and trying to reinforce the message that they are a vulnerable group and everybody needs to care for each other. So that focus group, we are putting some concepts to them, some ideas that we've had a bit of a brainstorm, and hopefully if that feedback is positive and it resonates with them, we'll try and get those up and running quick time and get those developed. And again, we're doing that for all kind of the sort of target audience groups, so that it's not one size fits all. Part of the activity to reach the over 60s is also recognising those in the sort of more remote areas. So we have written out, I think Lucy has done a letter out to parish councillors regarding some key messages and behaviour changes that we would like to see or reinforced. And hopefully that will then get spread amongst local community groups. And we're also conscious as well that with the sort of onset of the first lockdown, a lot of community groups were created, particularly sort of Facebook groups that are being reinstigated and have never actually stepped down. So we're looking at ways to how we can reach those Facebook community groups as well that were set up during lockdown and trying to create social media. I think there is a bit of feedback that that higher age range feel a bit digitally excluded. So we do recognise that not everybody uses social media. So it is important that we get into the non-digital channels. And that's some of the areas that we're looking at in our focus group to try and sort of challenge that. I think those are probably the key points that I wanted to raise today. Thank you.
Thank you very much, Claire, as always. I'm very impressed with, as always, with the comms team and the work that they're doing. It's very impressive. And of course, parish councils could be a very useful tool in your dissemination of information to the older age group, particularly in the rural areas. So I'm sure you're already on top of that and probably in contact with them, but they certainly are a very good source to get information out to some members of society that wouldn't necessarily listen to the radio or read the local papers and that sort of thing. David Jones, did you have a question?
Just a quick comment, Ian, to thank Claire and all the team for the very impressive networking. We've had some feedback through our Health Watch groups of people who've taken part in, I think, some focus groups around rural experiences and engaging with rural communities. They found that really helpful. People were listening positively and taking on board the feedback. And my own community network, I know exactly what Claire was describing. We've already had some information out from Lucy, has been disseminated through that WhatsApp group. So just to say that it is working and people are listening. So thank you.
Yes, and I would agree with David on that. I mean, you can't reach every single person, but I think our comms team are doing a mighty good effort at reaching as many people as possible, which is why we're seeing quite a lot, good levels of compliance and things like that across the county. It's been very impressive to watch. Claire, did you have any other points to raise on comms, or you?
I need to say, obviously, we're also very conscious that Christmas is a highly topical subject at the moment, and we don't know what the government message is going to be. Particularly, there seems quite a lot of debate on that. But what we are trying to do is gear up our channels and use all our channels so that there will be a breadth of audiences that we're trying to reach. We're conscious that there is probably going to be a real surge for shopping. And we're very conscious that, it's about messaging in those areas where I say before, high transmission areas where people will be thinking that they can go and do their usual activities, and reminding them that they're not going to be usual activities, they need to behave differently. And of course, we've got the vaccination programme coming, so we're working with our colleagues to prepare so that when we do know what we can say it to them and get the messages out there to everybody.
Yes, because Christmas, scarily, is not very far off. It's coming rapidly, and we will be prepared for that, I'm absolutely sure. Thank you very much, Claire, as always. Very, very comprehensive. I'm looking around the room. There don't seem to be any hands up. So in which case, I'm going to just mention, we've got one future meeting date, which is next week, the 26th of November at 8:30 a.m. We may initiate some changes with the meeting frequency and other changes that will be made, but we can talk about them more next week when we firmed up how we're going to move forward. So on that note, I will close the meeting and say thank you very much, everyone, for attending today. I think we've covered a lot of ground, as always, in this meeting. Thank you. Stay safe, stay well, and see you soon. And please do dial into the press conference tomorrow if you want to learn more about what's going on. Thank you very much. Good morning. I nearly said good afternoon.